Welcome to the University of Arkansas. In order to be eligible for benefits, you must be at least 50% appointed or more and not in a student title. Students, including graduate assistants, will obtain health insurance through the Pat Walker Health Center. The University of Arkansas's health plan is self-funded and self-insured through UMR. The provider network is through United Healthcare, and the pharmacy benefits manager is MedImpact. Faculty, staff, and their dependents are eligible for the health plan. Eligible dependents are defined as your lawful spouse and children up to the date they attain age 26. Children include your biological children, legally adopted children, stepchildren, and eligible foster children. In order to add your dependents to your health, dental, or vision plan, you must provide documentation such as marriage license for spouses and birth certificates for children. U of A employees cannot be covered on two U of A plans. If you are currently covered as a spouse or child of another U of A employee, you must decide between covering yourself or staying on the current plan. If you decide to take your own plan, please make sure the employee that is covering you drops you from their plan. UMR has a nationwide provider network. The University of Arkansas uses the United Healthcare Choice Plus network. This network includes many of the most notable hospitals in the state of Arkansas and the United States. You can search the directory prior to enrolling. The University of Arkansas offers 3 health plan options with UMR. The Classic Plan offers mid-range out-of-pocket costs and premiums, and no benefits for out-of-network providers. It is also eligible for Medical Flexible Spending Accounts, or FSA. The Health Savings Plan offers the lowest premiums with the highest out-of-pocket costs and is the only plan that offers a health savings account. Finally, the Premier Plan has the highest premiums and the lowest out-of-pocket costs and is also eligible for Medical Flexible Spending Account, or FSA. All plans are eligible for a Dependent Care Flexible Spending Account to use for child care expenses for children under the age of 13. You may choose to pay your health, dental, and/or vision premiums on a pre-tax or after-tax basis. If you choose to pay your health or dental on an after-tax basis, premiums are deducted after taxes are calculated, but you may delete, dependent, or cancel coverage anytime during the plan year without a qualifying event, and possibly deduct premiums from your taxes if you are itemizing deductions. Please consult a tax professional before choosing this option. Most often, employees choose to pay their premiums on a pre-tax basis, which deducts premiums from your checks before taxes are calculated. With pre-tax premiums, you must be within 31 days of a qualifying event to delete dependents or terminate coverage. The university's wellness incentive offers discounts on your maximum out-of-pocket expenses with the Classic and Premier plans and offers added health savings account contributions to the Health Savings Plan. The program focuses on 2 primary goals: promote preventative wellness exams and reduce tobacco use. To qualify for the wellness incentive, you must complete 2 steps. Complete an annual wellness exam conducted by a physician. Wellness exams are covered 100% by all 3 plans, and complete the tobacco pledge. Non-users pledge to continue to remain tobacco-free, and tobacco users will commit to enroll and complete a recognized tobacco program annually. In support of the university's tobacco-free efforts, a monthly $50 surcharge will be charged to you if you are enrolled in a university health plan and you do not complete the tobacco pledge, do not certify your enrollment in a tobacco program, or elect to continue to use tobacco. Health savings accounts are only available to employees who participate in the Health Savings Plan. Employees who participate in the Classic or Premier Plan, or who don't participate at all in the University of Arkansas insurance, can participate in a Medical Flexible Spending Account. Before we review what the plans covered, here are some health coverage terms you may want to be familiar with. Deductibles are a fixed dollar amount that you must incur each calendar year before the health plan begins to pay for covered medical services on deductible and co-insurance services. Co-insurance is the fixed percentage of charges you must pay towards the cost of the medical expenses for deductible and co-insurance services. A copayment is the fixed dollar amount that you must pay with each doctor visit, outpatient surgery, or hospital admission. An out-of-pocket maximum is the maximum out-of-pocket expense you will pay in any calendar year. This does not include pharmacy expenses. The next couple of screens will allow you to compare the 3 plans and can also be found in the Employee Benefits booklet on the Human Resources website. The SmartCare program allows discounts on out-of-pocket expenses for U of A employees who use the Pat Walker Health Center, and also allows discounts for U of A employees and covered dependents who use UAMS facilities. These discounts include reduction of office visit copays and reduced deductible and coinsurance when using a UAMS provider. To find a UAMS provider in your area, visit doctors.uamshealth.com. There is no need to enroll in SmartCare. The discount is automatic when visiting a SmartCare provider. Please note, your SmartCare deductible will count towards your regular deductible, and your regular deductible will count towards your SmartCare deductible. Now that you know your health plan options, how do you choose? We have put together a few examples to show what the total out-of-pocket expense could look like on each plan. Use these examples along with the questionnaire at the end of the slides to help in making your decision and choosing the health plan that is best for you. Let's look at Sam. Sam is single, healthy, and generally only visits the doctor twice a year. Once for his annual wellness exam, which is covered at no cost to Sam on all 3 plans, and this year Sam had to visit his primary care physician for a sore throat. Sam is in the 2nd salary tier, and the allowable expenses for this doctor's visit are $127, and his Tier 2 antibiotics are $75. If Sam were to choose the Classic plan, his cost for the office visit would be a $35 copay, and his antibiotic would be $55. On the Premier plan, the cost for the office visit would be $25, and the prescription would be $50. If Sam were to choose the Health Savings Plan, his office visit would be $127 applied to his deductible, and his prescription would be $75 also applied to his deductible, for a total of $202. We would assume that Sam would use the university's contribution to his health savings account to cover his expenses, which would mean Sam's out-of-pocket expense would be $0. Now that we've reviewed Sam's claims, take a moment to look at the annual premiums and final annual costs for healthcare on each plan. Now let's look at Jen and Mike. Jen is in the 3rd salary tier. They have 2 children, and the whole family gets their annual wellness visit each year, which is covered at 100% by all 3 plans. This year, their daughter has tonsillitis, which has total allowable expenses of $4,061, and their son gets pink eye and has to visit the urgent care center with total allowable expenses of $188. What are Jen and Mike's costs? If Jen and Mike did not have the wellness benefit and chose the Classic plan for their daughter's surgery, they would pay a $150 copay plus $1,250 that would apply to the deductible, plus $438 towards coinsurance and $55 for each of her 2 antibiotics, and a $35 copay for her office visit. For their son's urgent care visit, they would pay a $55 copay and $15 copay for his antibiotic, leaving their total out-of-pocket expense at $2,053 on the Classic plan. For the Premier plan, their daughter's surgery would be $650 applied to the deductible, plus $1,150 towards the coinsurance, $50 for each of the 2 antibiotics, and $25 for her office visit. Their son's urgent care visit would be a $50 copay, and his antibiotic would be a $10 copay, leaving their out-of-pocket expense on the Premier plan at $1,335. Now let's look at the Health Savings Plan. For their daughter's surgery, $2,700 would apply to the deductible, and $45.40 would apply to the coinsurance. They would pay 10% coinsurance towards their daughter's 2 antibiotics, which would be $78 applied to their out-of-pocket. Their son's urgent care visit would be $155 applied to their family deductible, and the prescriptions $33 applied to the deductible. We will assume that they will use the university contributions to their health savings account to use towards their expenses, leaving them a total of $3,024.10 to pay out of pocket. If Jen and Mike had the wellness incentive, as you can see, the only thing that would change is their out-of-pocket expense on the health savings plan, as they would receive an additional contribution from the university. Now that we've reviewed Jen and Mike's claims, take a moment to look at the annual premiums and final costs for healthcare on each plan. Finally, let's look at Barry and Wanda. Barry is in the 4th salary tier. They are empty nesters, but they are starting to have their own health issues. Barry and Wanda both get their annual physical each year, which is covered at 100% by all 3 plans. Barry has a stroke, and his allowable expenses are $18,856. As you can see on the Classic plan and the Premier plan, the ambulance and ER copay are waived if you are admitted to the hospital. In this example, Classic plan out-of-pocket is $5,340, Premier is $1,984, and Health Savings Plan is $3,415, assuming Barry uses the university's contributions to the Health Savings Plan. If Barry had the Wellness Plan, then his maximum out-of-pocket expenses in the Classic plan would reduce to $3,850, which would decrease his out-of-pocket expense to $3,940. His health savings plan expense would also decrease by an additional wellness contribution made by the university. Now that we've reviewed Barry and Wanda's claims, take a moment to look at the annual cost for the health care on each plan. So which plan is best for you? You may want to ask yourself a few questions, like what is your general state of health? Do you tend to see the doctor frequently, or do you take prescription drugs? Do you have a medical condition? If you are traveling outside your normal coverage area and are having a medical emergency, ER visits are covered as in-network if the condition is one of rapid onset or the result of injury, and return to one service area for treatment is not feasible, or person is not able and the treatment is medically necessary. If you are admitted to an out-of-network facility, please notify UMR within 1 business day after inpatient admission and submit all claims to UMR in writing within 60 days. UMR offers the disease management program to help manage not only the symptoms but the costs that come with chronic conditions such as asthma, congestive heart failure, diabetes, heart disease, hypertension, COPD, and depression caused by chronic disease. By enrolling in the disease management program, members can get many of their maintenance drug copays waived. There are also programs for smoking cessation and healthy pregnancy program that offers incentives such as copay waivers. When you receive your UMR ID card, you can use it to set up a profile on the UMR website. With your UMR profile, you can check claims and EOBs, order additional ID cards, or replace lost cards and manage your flexible spending account. You can also use your UMR card to set up a profile with the pharmacy provider MedImpact. The MedImpact portal allows you to find your in-network pharmacies, look up copays and formulary status, and drug information. The Health Insurance Portability and Accountability Act of 1996 exists to establish basic privacy and security of protected health information, or PHI, provide security for electronic and physical exchange of PHI, provide for individual rights regarding PHI, to guarantee individuals the right to access their health information and learn how it is used and disclosed, and to simplify payment for health care. Employees who waive health and dental coverage when hired may enroll at a later date if you have a HIPAA qualifying event, such as change in legal marital status, change in number of tax dependents, employee and/or dependent cease to be eligible for other coverage, or employee is court-ordered to provide coverage for a dependent. Voluntarily canceling other coverage is not a qualifying event. If you think you have a qualifying event, please contact Human Resources within 31 days of the event in order to add or drop dependents or add or cancel coverage. For questions, please email our benefits office at hrbenf@uark.edu or call Human Resources at 479-575-5351. Thank you for attending our virtual benefits orientation.